Hi there, everyone. My name's Unity. I'm the head of scientific services at the photobiology unit in Ninewells Hospital in Dundee. Welcome along to our first ever webinar, which is on how accurate is SmartPDT at determining daylight PDT light dose. This is a presentation that I originally gave at the EuroPDT conference, which was earlier in 2020. I do have a couple of disclosures to start with. So two of the authors that are named in this presentation are employees of C Health Limited, which is the company that we worked with on this research project. It was an Innovate UK funded grant for 2 years. And as a result of that grant, we now have the University of Dundee has an agreement with C Health Limited to deliver training on the SmartPDT product, and NHS Tayside will receive a limited number of licenses for use of SmartPDT with their patients as well. So that's my disclosures to start with. And so really, I'd like to talk about daylight PDT. Now, as many of you may be aware, daylight PDT, it's a fantastic treatment for actinic keratoses. It gives good clearance with minimal discomfort. It's really straightforward to perform. And importantly, it also has high levels of patient satisfaction. Our patients really love this treatment. But here in the photobiology unit, we are always looking to improve, and we think that daylight PDT could be better because there are a portion of patients who don't completely respond to treatment. So why is that? Why aren't they responding? Do we just accept that 20 to 30% of our patients won't completely clear? Or can we actually make the treatment better? One reason for poor compliance might be for poor outcome might be poor compliance. So if you treat patients with daylight PDT like we do, then during the daylight exposure, we allow the patient to go outside and do any outdoor activity they want. So how do you know that that patient's actually following your instructions? And specifically, how do you know that they've received enough light? Or actually, more fundamentally than that, we don't actually know what enough light is at the moment. And you'll be aware from the literature that there's thought to be a threshold dose that's required for daylight PDT to be successful. And the European guidelines say that this threshold dose is 8 joules per centimetre squared. However, did you know that that study which came up with that result derives it from only 37 patients, of which only 3 of them actually had less than that 8 joules per centimetre squared. And in that study, the way that they measured the light dose was by a specially developed watch, which was worn on the wrist. Now, the quantity of light that falls on the wrist is going to be very different from the quantity of light that falls on the face or on the scalp, which is our normal kind of treatment areas. So based on this study then, do we really know how much light is needed for effective treatment? And I would argue that we don't. And that's because it's really difficult to measure that light that the exact treatment area is receiving. So any attempt in the past to measure the light has often been restricted to centres with a specialist interest or those undertaking clinical trials. But we think that information should be available in routine clinical practice because we think it will help with patient management, But we also think that it will get us closer to truly knowing what that threshold dose is. And so for the past 2 years, we've been working with Sea Health to develop a solution. And the result of that research is a product called SmartPDT, which is a digital system that is composed of two parts: a smartphone application and a web portal. Now, the app is for the patient, or could be even for the PDT nurse, and it assists before, during, and after treatment. And during treatment, it displays in near real time the patient's accumulated light dose. And I can show you that. You might see that here. This is the accumulated light dose on that section. But it can also display the accumulated UV exposure, which is what we see here. And that's to help prevent sunburn during treatment. The system also takes into account the sunscreen that's being used by the patient as well, and builds that into both the calculation of the light dose, but also of the risk of sunburn as well. Okay, the second part of the system, then the other half, is the web portal, and that's for clinicians. The web portal allows us to schedule our treatments, and it actually highlights when the most appropriate treatment times might be, taking into account the weather forecast, but also the predicted light dose. And the portal has an automatic connection to the active smartphone apps, which allows the medical team to actively monitor the patients that are undergoing therapy. Now, at the core of SmartPDT is this ability to determine the patient's light dose without any light detector, just using the patient's location, and that's what comes from the smartphone. The system uses real-time satellite images and computer algorithms to determine what the light dose is. And it can also use weather forecasts from third parties to predict what the light dose is going to be either tomorrow or the day after that. So we were interested in putting that to the test and wanted to investigate just how accurate SmartPDT really is. So to test that accuracy of SmartPDT's calculations, we compared it to some ground measurements, which were performed by Public Health England at their site in the Harwell campus, which is just outside Oxford in the UK. And we looked at data from relevant clinical daylight PDT treatment periods. So that was August to the end of October in 2018, and April and May in 2019, sorry. And we analysed the data in fixed 2-hour treatment periods from 8 in the morning through to the 5 in the evening. All different weather conditions were considered in this data, and we actually only excluded data if the PDT light dose was less than 2 joules per centimetre squared, which is far less than is thought to currently be clinically relevant. So the result of that criteria meant that we had 3,892 data points for each of the 4 techniques. So in total, more than 15,000 data points were analysed. And the results were excellent, showed excellent agreement between SmartPDT and the ground measurements. The mean difference between any of between any of the SmartPDT techniques and the ground measurements was less than 2%. So you can hear that is all less than 2%. The most accurate one was the SmartPDT real-time determination. You can see the overall mean difference was lowest, and actually 95% of results are going to be within plus or minus 10% of the ground measurements. So basically, just less than 2 standard deviations is within plus or minus 10%, which is an absolutely excellent result. The accuracy of the technique does decrease as SmartPDT tries to forecast further into the future. And we see that in the increasing mean absolute difference, which you can see here, and in the increasing standard deviation. But actually, it's best visualized in these graphs here. So here you can see, if we go from the left of the screen, this is the real-time determination. This is the 24 hours in advance forecasting and the 48 hours in advance forecasting. You can see that the spread in these graphs increases the further into the future that we try to predict. Now, that's to be expected because forecasting light dose requires weather forecast information, and that information is less reliable the further into the future that one's trying to forecast, particularly in a variable weather climate such as the UK. Also keep in mind that this data represents all weather conditions, so despite that, there is still really good agreement between SmartPDT and the ground measurements as well. In fact, if we look in terms of accuracy of SmartPDT, it performs better than the other measurement systems which have been reported in the literature, with the exception, of course, of the spectroradiometer, which is the gold measurement, gold standard for measurement, and it's what we compared to in our study as well. However, spectroradiometers are large, bulky pieces of equipment. They require expensive calibration, and they require expertise to operate as well. What's great about SmartPDT is that it's really simple. All that is required is a smartphone. And it's also personalized. It's specific to that particular patient at their location during therapy. And so overall, from our data analysis, we would say that SmartPDT provides accurate, real-time and forecasted light dose information. And for the very first time, it makes that information routinely available in clinical practice. More than that, though, this technology could facilitate self-administrated daylight PDT, freeing up more clinic time whilst giving the doctor still overall control of the treatment. Now, whilst our research has shown that the technology behind SmartPDT is accurate, the next stage for us is to investigate with our patients how simple and how convenient that system is to use. Thank you for tuning in today. Thank you for listening, and I'd be really interested in any comments you have on this presentation.